All right, so I'm here today with Dr. Voltaire Sinigayan, who is a hospitalist physician here at UC Davis Medical Center in the Department of Internal Medicine. And he was formerly the vice chief of the hospitalist division. And I worked very closely with Dr. Sinigayan, providing urgent providers staffing during the pandemic when their group was overwhelmed. Also, subsequently, based on that experience, I worked closely with Dr. Sinigayan in developing a hospitalist provider team consisting of nurse practitioners and physician assistants, which is now quite established and has grown. So I'd like to ask Dr. Sinigayan a few questions today that I can share with my Norwegian colleagues. First, how was your experience working with nurse practitioners in managing internal medicine patients? What would you say NPs bring to the table?
So first I want to start off the work that Lars has done with us and working alongside with us. And Lars as a leader has been tremendous. We couldn't have asked for anything more. I mean, he's brought a lot and a ton of help to our group. In terms of my experience with Lars and the nurse practitioners that he's brought on, I think it's been really awesome. There was a time at UC Davis where we didn't use nurse practitioners at all. And actually, when we first started with Lars and the nurse practitioners and physician assistants, there was very little exposure to our physicians with nurse practitioners and physician assistants. So in essence, we actually didn't really know how to work with them because we, as an institution and even as a department, didn't have very many to little nurse practitioners working alongside with physicians. But we quickly recognized the need that we needed more providers that can work alongside with physicians and expand our footprint in the hospital, but also expand our services. We wouldn't be able to do our jobs as physicians without Lars and his team. Because one, I think as COVID taught us anything, it's that we definitely need more providers to provide care throughout the hospital and to kind of grow our reach in terms of generalists in the hospital. You have your specialists, but for us as internal medicine, but specifically as hospital medicine, we couldn't care for that many physicians without the help of nurse practitioners. And so my experience with nurse practitioners has been very positive. And in fact, I'm a strong supporter of nurse practitioners and physician assistants working alongside with physicians in any setting because of what Lars has done and working alongside with him in these last couple of years.
Tagging on to that, and thank you for those kind words. How has the integration of nurse practitioners been perceived in general by our hospitalist physician group, and what factors or strategies do you think were important during the integration process?
I think, in all honesty, there was I don't want to say a stigma, but there was a apprehension in working with nurse practitioners, just because, again, we weren't very familiar with working alongside nurse practitioners. And I would say that COVID and the need for a clinical engine actually accelerated that relationship. And so instead of actually choosing to work with nurse practitioners, it was actually a need. So I would say in that aspect, we didn't have a choice, but it was actually a good thing because as we worked alongside with nurse practitioners throughout COVID, it became more and more apparent that we were able to work with nurse practitioners and we became more and more comfortable. There were some growing pains, I think, just because of the level of trust. It was never that we didn't think that nurse practitioners could do the work, but it was how we were going to interact with them, what responsibilities were going to eventually pan out in terms of the relationship. And I think once we started hashing out kind of roles and responsibilities, it started becoming more apparent, more clear what our roles would be. And in fact, actually, it's morphed over time. Now they are an integral part of our group instead of just being kind of just there to help, in so to speak. Because again, initially they started off, nurse practitioners started off as kind of a need to help us with staffing during the pandemic. Now they work side by side and hand in hand to the point where they work alongside us. They have their own teams within the hospital that carry a large load of patients, actually. And now we have what's called dyad teams, which both a physician and a nurse practitioner work alongside together to not just how do I say, not just as kind of a hierarchy, but more of working side by side alongside a team. And so we actually distribute patients between each other and really work well alongside with each other. And they work with us during admissions in the hospitals and along with discharge. So there's almost actually no difference in terms of what a physician does and a nurse practitioner does. It actually helps expand our reach in the hospital and taking care of patients. So again, they are an integral part, and rather than just them as helping out with staffing, they actually work alongside with us, and they are in need in terms of their skill set with taking care of patients.
What's the nature of your interactions with the NPs? Like when you're on shift together, how does it work?
So they are actually, I see them as an equal provider with the physician. Without them actually, especially because I do a lot of admitting shifts from the ER into the hospital, and I work mainly at night. And so we usually have 1 to 2 nurse practitioners working alongside us at night. And we are all a team. And the way that I interact with nurse practitioners is they are right alongside me as my colleague. Because without them, I wouldn't be able to do my work. And without me, they wouldn't be able to do their work. So we work together hand in hand, and our responsibilities are exactly the same.
Actually, I had the pleasure of working on a night shift with you recently. And basically what we do as nurse practitioners, we interview the patients, we place orders, we call necessary consults, and then we approach our attending physician kind of like a consultant as the expert. We mention what our general impressions and plans are, and we see, based on your depth of experience and training, is there something you can add to it? And that extra layer of wisdom and expert opinion is really helpful to us. As nurse practitioners, we are really well trained in the bread and butter of medicine, and we're good at taking histories and exams and developing plans. But it's important to have that team atmosphere, I think, where we interact and build on each other's unique skill sets. That's been my experience in developing this team and this group.
And I totally agree, Lars. And one of the things I think it's been great is able to coach and mold nurse practitioners into the practice. And I think that's one of the actually benefits of having nurse practitioners is they're eager to learn the practice that I practice, which is hospital medicine, but they're easily moldable in terms of how what the group needs are in terms of they need a clinical engine, if they need some type of expertise. I think that's one of the benefits of having nurse practitioners is they're very moldable into the practice and the group needs.
Excellent. Finally, Dr. Sinigayan, just in general, how do you see nurse practitioners fitting into future staffing needs in United States hospitalist programs? Like, what does the future look like, do you think?
So I think we're already there. If anything, what COVID has taught us is the nurse practitioners are very capable in terms of in any setting and filling the needs of a group, and they are and that if you could want to extend the your clinical footprint in terms of your group, and which is what we did as hospital medicine. We really needed quickly to expand in terms of our services, and plus we needed folks that can be easily moldable in a relatively quick amount of time. And so, again, I think at UC Davis, we've exponentially grown in terms of the number of nurse practitioners working alongside physicians. And I never thought I would see the day in terms of having nurse practitioners working side by side, or the number of nurse practitioners that we have in our group. But now that we're there, I think the future just is endless in terms of the uses of nurse practitioners, in terms of how we kind of want to mold what our needs are. For example, we have them in facets in terms of rounding with physicians. We have them admitting with physicians. And then I actually don't see a limit in terms of, one of the things that hospital medicine needs is setting up discharge clinics and follow up with patients in terms of the outpatient setting. And I think that's one avenue that hospital medicine has tried to explore and expand in terms of the need for nurse practitioners. I think, in terms of where we can use them further, we can use them in any setting that we need to expand to. And I think that's the awesome ability of nurse practitioners to be molded into your needs of the group. And so I think that the way we use nurse practitioners is endless. And I think anytime you need a provider that you can quickly onboard, I think nurse practitioners are actually an option.
That's great. UC Davis traditionally used NPs much more in the surgical services. They've been there for decades, and we had quite a large number, but hospital medicine, we were really breaking new ground, and it's been really satisfying to see how we've been able to integrate and now continue to expand as we continue to add roles and more teams, etc. So really have appreciated the collaboration with our very supportive physician leadership and the hospitalist group. So thank you for joining me today.
Yeah, of course. And we've loved the collaboration we've had with nurse practitioners and Lars. Again, it's been an amazing experience. And, I think, like I said before, there was hesitation in working with nurse practitioners, but now there's such a excitement and want to work with nurse practitioners. Because again, it's been a wonderful collaboration.
Thank you so much.
Thank you.